right. I would rather be in an office talking with you individually than speaking to all 290 of you all at one time. So you'll forgive me if I falter a little bit in this presentation. I'm going to thank you in advance for allowing me to share my thoughts with you on integrative medicine and how I see the role of physicians in bringing this particular body of knowledge into the mainstream of current medical practice. For those of you whom I've not yet met, I am a practicing physician in Waipahu, having grown up in the same historic community for some 40 years. There's no one here from Waipahu yet. There are. Well, if I may just, I want to digress a little bit, but there's one person I would like to recognize from Waipahu. I met her some 20 years ago. She introduced me to MOA, and I'm very, very thankful for that. Her name is Haruko Oshiro. If she would please stand. Without her patience and without her generosity, I would not be speaking for you today. My medical training is from the University of Hawaii, as well as my residency in internal medicine. I have an emphasis in primary care medicine and a secondary interest in integrative medicine, also known as complementary and alternative medicine, and in particular, Okada purified therapy. 60 years ago, Mokichi Okada, the founder of MOA, celebrated the completion and opening of the first public art museum in Japan. This museum highlighted primarily Japanese art. In the same time period, he completed a manuscript entitled Saving and Rescuing America, as Leslie Lexier had mentioned earlier. In this manuscript, he proposed a worldwide transition to a higher level of wellness and health could be attained, but only if the United States were at the forefront of this movement. Remember that this was immediately post-World War II when he wrote this piece. He based the premise on the perceived changes in the health conditions of the Americans, the rapid growth of medical knowledge and medical technology, and the political climate that catapulted the United States into the forefront of world powers. So great was his respect for America, and so great was his concern in seeing the health changes in the status of its citizens that he wrote this essay. Today, much of his book has materialized, is becoming readily evident. Our own experts have documented time and time again the increases in cardiovascular disease, the increases in cancer, the increase in the lifestyle-induced illnesses, obesity, tobacco and alcohol abuse, the prevalence of anxiety and depression, and the medical, psychological, and economic impact of aging and dementia. Like the United States, countries in all directions are seeing the same developments in their citizens. Truly marvelous medical advances in pharmaceuticals and technology have been helpful in combating these problems. But I believe we seek something more. I believe we seek a renewed practice of medicine that not only resolves illness, but advocates wellness and incorporates spirituality. Enter MOA. Mokichi Okada considered that health and wellness developments here in Hawaii as predecessors to changes of health in the United States and to the rest of the world. His long envisioned and long-awaited dream of a wellness center in Hawaii has materialized. The center specializes in the cornerstones of MOA: food and nature farming, arts and culture, flower arranging and tea, and Okada purifying therapy. In addition, we are fortunate to have collaborative efforts with the University of Hawaii's School Department of Complementary and Alternative Medicine. We also have collaborations with various medical and ancillary healthcare professionals and practitioners of acupuncture, Ayurveda, and other CAM specialties. We hope to find a truly comprehensive and we hope to bring a truly comprehensive and integrated style of healthcare to the state, just as our colleagues in Los Angeles have done. What would be the physician's role? I think not much different from our current roles in providing primary care. I think this is a golden opportunity for us to provide the best of the best. The traditional allopathic Western styles of practice, the time-tested and hopefully soon to be validated complementary and alternative styles of practice, and the ever-increasing need for humanity and spirituality in healthcare and wellness promotion. Primary care doctors are often thought of as gatekeepers into the healthcare system. For me, this carries restriction and rationing implications. I like to think of us as navigators through a complex maze of technology, medical specialists that often lead to frustration and often lead to fear. I am here to suggest that the right course of care for you, my patient, at this point in your life. I am also here to answer your questions and offer alternatives and promote reassurance that your choices are appropriate, not mine. The same holds true for alternative and complementary medicine. Now, this will of course necessitate that I and my colleagues educate ourselves in the various forms of CAM, a task that is no less arduous than the one taken for traditional medical school and advanced training. For myself, it is an exciting adventure through uncharted areas, and I hope that those physicians who chose to provide integrative medicine will think of it in the same manner. There needs to be more proactivity on the basis of health, diet and exercise, stress reduction, and other lifestyle modifications. Additionally, there needs to be more giving to others. To quote a well-known Franciscan cleric, it is in giving that we receive. In my 20-plus years of private practice, I have come to appreciate the importance and necessity of a spiritual base in our lives and in maintaining good health. One of the basic tenets of MOA philosophy is that the spiritual self precedes and often dictates what happens to the physical self. We all have it. Some of us are in touch with it more than others. In my work with MOA and its members over the many years, they have helped me find my spiritual base and to share this base with them and many others. How will we measure our success? Later in this program, you will hear of several people whose lives have been positively changed by MOA. My MOA colleague, Dr. Suzuki, will tell you of the safety and effectiveness of Okada purifying therapy in another session. Ultimately, we see tens of thousands of smiling faces like those you see in the slide. This was taken during one of my Healthy Life Network visits. When committed, compassionate, and caring are more than terms for a slide and a presentation. When each of us can connect with our inner selves and with our others, that, folks, is how we are going to measure our success. Thank you.